We at the Office of National AIDS Policy wish you and yours a safe holiday season and a happy, healthy 2015. As we move into the new year, we will face some exciting challenges and opportunities. The timeline for the quantitative objectives of the National HIV/AIDS Strategy was set for 2010 to 2015. So 2015 will be a year when we look to develop a new timeline, and we will be looking to all of our partners to help us develop that new timeline. I think that together the National HIV/AIDS Strategy, its companion document on the HIV Care Continuum Initiative, the report on the addressing the intersection of HIV/AIDS, violence against women and girls, and gender-related health disparities, and the implementation of the Affordable Care Act form a solid foundation for the work to be accomplished. Still, 2015 will be a time to consider any additional steps within the strategy's goals. At the White House on World AIDS Day, Dr. Anthony Fauci reviewed the science, which tells us about how we can move toward zero new infections, and emphasized the importance of 3 key actions: expanding HIV testing so that we can identify those unaware of their infections, linking those diagnosed with HIV to care and treatment, since individuals who achieve viral suppression can live a nearly normal lifespan and are substantially less likely to transmit the virus, and focusing on what he called the prevention continuum for those who test negative for HIV. Dr. Fauci underscored, and my federal colleagues and I have discussed, that HIV risk is not uniformly distributed. There are, as researchers have observed, hot zones or microepidemics among vulnerable populations that require our concerted attention and tailored combination prevention efforts if we are to successfully bend the curve. Having these conversations in the context of updating the National HIV/AIDS Strategy will require open hearts and open minds from those of us in the public and private sectors. It will necessitate a dialogue on aligning the resources with the epidemiology. We will use science to understand what we are doing that can be scaled, adapted and tailored, or discarded. President Barack Obama opened the World AIDS Day observance with videotaped remarks in which he observed that we are closer than we've ever been to achieving the extraordinary, an AIDS-free generation. Noting that both science and momentum are on our side, the President encouraged all of us to continue the fight, remain focused, and recommit ourselves to achieving an AIDS-free generation in our lifetimes. I join you in that recommitment, and I thank you for your commitment, your tenacity, and your indomitable spirits. As we gear up for an exciting year ahead, where we will move towards the President's challenge of getting it done, together, let's continue to implement and enhance the National HIV/AIDS Strategy in 2015. Thank you very much.